All right, it's a beautiful Monday morning. Good morning. Thank you for joining us on TVC Breakfast. I'm Veronica Dan Ikpoi. I'm not here alone. I have Kemi Folademo.
Hey, Veronica.
It's a Monday.
Good morning. Yes, it is. And welcome back. Good to see
Thank you. Thank you very much. It's good to be back. All right, let's head straight to the stories. And we begin with the Lagos State government saying it has suspended the general manager of the Lagos State Infrastructure and Asset Management Agency, LASIAMA, Adenike Adekombi, over Dr. Waire Diaso's death in a crashed elevator. Dr. Diaso is said to have died last week when the elevator she was in crashed at the General Hospital, Odon, Lagos Island. The state government released a report of its initial investigation into the tragic incident, which indicted the facility managers and LASIAMA. It added that the government had handed the installation and maintenance contractors to the police for further investigation and likely prosecution if they were found culpable, saying that the police would also investigate anyone else that might have been found to be negligent. Well, that's the update we are getting with regards to this. And then we also hear, Kemi, that the Lagos State government, the Lagos State Safety Commission is mandating that there has to be an audit of all elevators in public offices. That's a good one coming out of that decision. And we also hear that some other persons were set on suspension, okay, like we mentioned. I think it's a good development coming out of the statement coming out of the Lagos State government with regards to the incident that has happened. Unfortunately, someone passed before we are seeing this decision coming on now, because we heard that this elevator had been bad for some time. But it is good that we are seeing some decisions, and we are waiting to see what will happen at the end of the day. Those found culpable being brought to justice. Perhaps this will bring some level of closure, even though it cannot revive the person that has passed. But it might bring some level of closure for the families.
It's really a very sad development, at least looking at what we have heard, online from the late Dr. Indiaso's colleagues who, as you mentioned, said that they had been complaining about that particular elevator, up until the moment when it crashed down on the late doctor, the very promising lady. But interestingly, from the interim reports that we have seen, the government says the entire structure, the elevator inclusive, was newly constructed about 2 years ago or thereabout. And so we wonder, there was no mention of the fact in that initial report, there was no mention of the fact that acknowledging the complaints that users of that elevator had been complaining of. So it's interim anyway. So it is expected that there will be more information and feedback from the government on this issue. But we also hear from the dailies now that the government has also denied that there was shortage of blood at the time when she was rushed at about 7:30 p.m. when she was said to have been extracted from the elevator that had already been destroyed, apparently, and then rushed for emergency checks and other before she was pronounced dead at about 8:45 p.m. They said there was no request for blood because there was a ready bank, and if need be, there was also a ready bank of people who were willing, of donors, who were willing to supply blood at the shortest notice. So that's also another controversy that it doesn't appear that the state government has dealt decisively with that. But from what we have seen so far, the sack, the suspension, it's surely the least. It's a step in the right direction, but much more needs to be done to console the family, because what do you say to a family in that situation?
Who has invested so much on her?
Right.
Some persons were looking at the cost of sending your child to school to study medicine as it is at this time, especially at a private university. the number of years, having to pay a huge sum. And then at the time when she is about to say that, okay, I am done with all of this efforts that you have put in to just for the parents to reap what they have sown, and then she passes on as a result of negligence on the part of some persons. And yes, a lot is to be said, but not to, dig into wounds that people are trying to heal at this point. It's really unfortunate, an unfortunate incident to see that she had to pass as a result of this really, really sad incident. And we hope that we get a report from the police in no time, and those who have to be brought to book, because Nigerians are waiting, or Lagosians are waiting with fingers crossed. Not just Lagosians, Nigerians are looking at this story because we saw that this has led, there was an uprising at the end of the day with regards to what happened, and Nigerians are waiting fingers crossed to see how the state government will handle the whole matter at the end of the day.
Yeah, it's very important, so her death isn't in vain.
Yes. So come Wednesday, the 9th of August, the Nigerian Association of Resident Doctors will embark on a nationwide daily protest to insist on its demands, which it believes have been neglected by the Ministry of Health and the federal government. Now, the protest will include picketing of the Ministry of Health, Office of the Head of Civil Service, as well as federal and state tertiary health institutions across the country. Recall that the association had embarked on an indefinite strike on the 26th of July over agitated issues despite interventions by the Secretary to the Government of the Federation and the Speaker of the House of Representatives. This recent decision taken by the association's National Executive Council comes days after the Ministry of Health instituted the no work, no pay policy against the striking doctors. Another one with regards to doctors here. They say they're going to embark on a daily peaceful protest, they call it, picketing federal ministries of health offices and civil service, as we have pointed out. And they are saying that their demands have been largely neglected by government, and that they have made genuine efforts, but it seems the government is demonizing resident doctors despite sacrifices they have been making. And it is another concern for Nigerians, the impact this will have on the healthcare system that we have been talking about to be in tatters, as some have described it. Recall that they had given the government an ultimatum. That was sometime in July 19th, and nothing, they say, was done, and so they embarked again on this strike. Now, some Nigerians are calling for dialogue with the doctors, but how much of a dialogue are they going to have? They've been having that with government. What more can they do at this point?
And that's why the NAD leadership, that's the Resident Doctors Association's leadership, said Nigerians should get ready, especially the government should get ready for what they were going to do this week. I think that position was before the announcement that they were going to embark on this next round of protests, and it's kind of unprecedented, from where I stand. It's unprecedented because there's a strike, it's bad enough, and now we're going to see doctors. I'm sure it's going to be in their regular outfits now, sending a loud statement, no doubt, picketing strategic locations, including the office of the Permanent Secretary of the Federation, and other locations. It really says a lot about the strike this time. It's a recurrent move, especially with the federal government's latest reaction of the no work, no pay, invoking that no work, no pay policy. Yep. It really says a lot about the state of things in the country. But to speak for the federal government, it has pleaded for some form of understanding that there is no substantive minister at the moment. And yes, a list has been drawn up by the president, but no portfolios have been announced yet, and hopefully that should happen this week now that everyone has, or rather the final list. So we hope that the final nominees will be screened, totally by the end of today, because the Senate will resume that exercise today. So it should expect that what the next thing that should happen will be the announcement of portfolios. So we wait and see. We can only hope that some form of, patience, if both sides can encourage, more communication, more dialogue, and possible resolution.
But from the statement they are making, they have given government time enough, and it seems the government is taking them for granted. So that is why they are saying that they want to make a statement this time around for the government to understand how things are, how the shoes are pinching, because they are saying that a majority of their colleagues have left the country. And so there has to be some replacement of these persons that have left the country, because they are overstretched as it is. What it is now is about 5,000 patients to a doctor. This is against the WHO's recommendation of about 600 patients to a doctor. Look at that number. That is what they are saying, one of the demands they are making of government, and other demands that has to do with the allowances and trainings and all of it. All of this is to improve the system at the end of the day. How are they putting for their position? Because at the end of the day, there has to be a level playing field. When the elephant fights, they say the ground suffers. Nigerians who are patients are the ones suffering at this point. We recall what has happened sometime when we had the strike, patients passing as a result of doctors not being available to attend to them, and we know the attendant impact on the healthcare system. So what do we do at this point? Dialogue or not?
It has to be. There has to be some form of dialogue. There has to be some form of icebreaker at this point. Government has, given an option, given an offer rather, and that has been rejected as, being too little. Minimal, too little. And so there just has to be some form of government also has to come with, some form of believability, because it appears that we all know they have walked this road. Okay, fine, it's a new government, but then the issue of patience, give us patience, this is what we have to offer, we are all in this together. All these narratives are familiar, but these guys are saying they want something much more than what the government is saying this time around. And some of these issues are inherited challenges, for the present administration. So perhaps that might be another way for them to, capitalize on, but perhaps they also need to look inward and see what more can give, because beyond the allowances and the demands, from what I see, there is also, the angle that these demands also affects the health sector. Somehow the issue of replacement, immediate replacement of people who have left, immediate recruitment of existing vacancies in the health sector, in the hospitals. These are issues that will not only
begin to look at the processes to make it easy
as soon as possible.
Yeah.
These are issues that will benefit the doctors themselves, who cannot afford to break down. They cannot afford to make an error, while administering needed services to patients. These are issues that will also benefit residents and ultimately government, because we are all Nigerians. We all need health services at one point, or the other. So there just has to be some form of, commitment.
Something has to give.
The president has already spoken about his intentions. He has spoken about his good intentions. Now it's time for the lieutenants to emerge, and now it's time for them to also, speed is of the essence. People are looking up. There are so many challenges in the country at the moment, but health is wealth.
Absolutely.
And that is a fine place on my end to at least, let us see deliverables in that sector.
From what you have said, let's look at the low-hanging fruits that we can easily address. You mentioned the matter of replacement of their colleagues that have left the country. Is the process cumbersome that we need to look into to ensure that we replace these persons as quickly as possible? Like you rightly pointed, time is of essence. The number, how can we have a doctor attending to 5,000 patients? That is really not healthy for the system. And when you look at the rural areas, you see a dearth in the number of medical doctors and all of that. So I believe that government has to address this matter as quickly as possible to ensure that the system does not break down as it is, because the doctors are willing and ready to make a statement at this point with this peaceful protest that they have said they are going to embark on beginning Wednesday. Well, I believe this is where we'll leave the conversation for now. Let's take a breather. And when we return, we'll review top stories on the front page of Nigeria.